Dr. Morgentaler.
Dr. Brandon.
It's so great to see you. So we're going to talk today about people who don't feel guilty when they cheat.
Let's hear it.
Then people who don't feel remorseful when they cheat.
What do you got?
Well, there's an article in my favorite journal, The Archives of Sexual Behavior, that was published in 2023. And they surveyed people that were on the Ashley Madison website. You know the Ashley Madison. We actually saw a documentary about the Ashley Madison website.
Yeah, but I got to stop you. How lucky am I to be doing a podcast with somebody whose favorite journal is the Archives of Sexual Behavior? Behavior?
It's great. It's so great.
Right.
It's so chock full of information. I look forward to this journal, but yeah.
I'm so lucky.
Yeah.
Okay.
So this in this article, they surveyed people that were on Ashley Madison, and they kind of wanted to understand what motivated them to cheat. So Ashley Madison is a cheating site, basically. It's a website for people who are in relationship but want to cheat.
Right.
And so these researchers wanted to understand what motivated people to cheat on this site, and did they feel bad about it? And did it damage the relationship? Questions like that.
Yeah.
So it was, I think it's a very interesting topic. It's not how researchers typically...
Before we start, a small disclaimer. The Sex Doctors podcast is not a substitute for medical or psychological advice.
Welcome to the Sex Doctors, featuring Dr. Marianne Brandon, clinical psychologist and diplomate in sex therapy, and Dr. Abraham Morgenthaler, renowned urologist and expert in sexual medicine and testosterone therapy. Together, they bring you expert insights into sex, intimacy, and relationships. Let's dive in.
Approach cheating.
Right. What an interesting group. What were the takeaways from your point of view?
Well, I think that the primary takeaway was that, to me, was that most of these people felt like they loved their partner, were very happy with the relationship, and that the affair didn't hurt the relationship. But what motivated their affair was sexual dissatisfaction.
Right.
And they didn't feel guilty about the affair because they weren't sexually satisfied in the relationship. So they felt like this was a fair outlet for them. That was kind of the way I summed it up in my mind. What about you?
So, whenever we see research or read research, we always hope that we can generalize from the findings in this study to the general population, right? We call that generalizability. And often we can, or at least elements, but sometimes it's a mistake to do so. This might be one of those times. And the reason is this: a very specific group of individuals. And I don't mean to make light of it by chuckling, but listen, so this is a website that it is there exclusively for people who want to have sexual affairs outside of their primary relationship. Right?
Right.
And of course, the researchers give this great jargony name. They call it, instead of cheating, they call it consensual extradyadic behavior, right? A dyad is like a twosome, right?
Right.
So funny. And not only is the population being surveyed here part of that website, but these people were invited to participate in a survey, and they did so.
Mm-hmm.
That's a certain kind of person. And this website was just hacked a few years before this paper was done to big media stuff.
Yeah.
People's names were exposed and all these things. So these are people who are willing to take a certain amount of risk to do this.
Absolutely.
Right?
Bold people for sure.
One of the shocking things for me was how many people agreed to do this survey.
Yes.
There's over 2,000 individuals.
I know.
About 85% were male. They ended up with a little over 800 from the original 2,000 who met all the criteria. And the first thing to notice was the average age was 51.
Which was, I think, very noteworthy because much of this research is done on younger people who haven't been in very long-term relationships. And so that also limits generalizability. So to have like middle-aged folks, I think is very interesting.
Well, I think it's a positive in terms of not just the college-age kids.
Yeah, right.
Right? Like,
right.
So these are people who generally you would think at that age, have had relationships that are longer than 6 or 12 months.
Yeah.
Right. And some of the findings were that about 50% of them claimed that they had permission from their partner to do something extracurricular. And I think this is very important, is that 2/3 of them, before signing up for this website, had been involved with prior infidelity.
Yeah.
So this is a very specific group of individuals, and I'm not so sure that this applies to all.
I so agree with you, because so often in my practice, people will come in and say, I can't believe I cheated. I never thought I would do that. It's not like a premeditated thing like it would be on an Ashley Madison site.
Yeah. To some extent, these are people that have cheated. The majority have cheated, large majority, and are willing to answer questions about it. And their attitudes may be different than the average person who does it. Many of whom, and you and I have dealt with this professionally, feel enormous shame and guilt, realize that it's really a catastrophe for their primary relationship.
Right.
Yeah. Or they've been cheated on. And the same thing is true, right? Like this is a different kind of thing.
Right.
Importantly, there were two things that really struck me. One is that a majority of them expressed love for their existing partner.
Yeah, they did.
So this wasn't, I'm just in a terrible relationship, I'm at the end of my ropes, let's do this, I'm stuck somehow. And 50% of those relationships, or approximately half rather, were not there's no sexual activity going on. Yeah.
So they felt justified to get their needs met in this way.
And if we looked at, in this one figure, about the primary reasons why they did this, why they were willing to do this, the number one reason was
Sexual dissatisfaction, right?
Right.
Yeah.
Number two reason was very interesting for me to see, which is so they gave me choices, and this one they called autonomy. And it can be interpreted different ways, right? But in essence, it's about how I would interpret it is the person feels like they are an individual, right? And that they're not necessarily bound by what happens in a relationship.
Or sexually controlled by their partner, because I do hear that struggle pretty frequently in my therapy room, that people feel like their only outlet is their partner, and their partner dictates how the sexual relationship unfolds. And that's very challenging for people.
Yeah. And there's another side to it too, that applies for sure. And that's why I say how it's interpreted, because whoever is responding to this is responding to this in the way that what autonomy means for them.
Yeah.
Yeah. And there are some people who say, yeah, I'm in a relationship, and I respect my partner, but I'm an individual within that relationship. Right? Like my life is not entirely ruled by the fact that I'm married or in a relationship. Now, we're not judging this. This is just what they're responding.
Right.
Right? Yeah. And then the other top ones were low level of commitment, presumably in the relationship. That makes sense. And then the last one is variety.
Variety, yeah.
So,
and I've heard in my practice, folks say they have a sexual dysfunction with their partner, like erectile dysfunction, but they don't have a sexual dysfunction with their affair. They have low libido with their partner. They don't have low libido with their affair partner.
Yeah.
So that's a motivator too. I was surprised not to see that as its own category on that list.
Yeah. That happens. Amongst my patients too, you hear about people who may, for example, have erectile dysfunction with one partner, but they never had it before with other partners.
Right.
Or maybe they step out of the relationship and they don't have it with another person, right? And so that becomes an outlet for their sexual fulfillment.
Yeah.
Complicated.
It is complicated. And, in our culture today, we really promote people expecting to be sexually satisfied throughout their life, like it's a right.
Yeah.
And so people do expect to be sexually satisfied throughout their life.
Yeah.
And so I think that concept promotes some people to
and people, listen, it's relationships are hard.
Yeah.
The sexual part of it is complicated too, especially even if everything goes swimmingly for the first, let's say, 6 months to a year, stuff happens.
Yeah.
Life happens. And we've talked about how much sexual dysfunction there is, both for men and for women, right? Like to the point where the numbers are staggering.
They are. 40% of women, 30% of men report a sexual concern or dysfunction in the past year.
Yeah.
Those are staggering numbers.
Right. And if you look at men between 40 and 70, 52% report some degree of erectile dysfunction. Right. So there's a lot of that goes on. And how one's partner responds to whatever that dysfunction is, and whether the couple can come to an arrangement, that may not be the nicest word, can figure out a way to get everybody's needs met. Right, in a way that feels great. That's a challenge of its own, and that doesn't always happen.
That's true. But I'm hoping with AI that people will be more successful at finding a middle ground there.
AI.
Yeah, sex tech, because now there are so many options for people. I have this conversation with couples in my practice.
Tell me.
Which is if there's a desire discrepancy or sexual dissatisfaction on the part of one person, what are the other options that are fair for that person to get some sexual, pleasure? So we talk about things like VR porn, because VR porn is much more intense than old-fashioned porn. People feel like they're in the experience and having it happen to them. And you can make that even more intense with sex toys that kind of work in conjunction with the porn. This stuff is not hard to access at all. Or you can sext a chatbot. I mean, there's a lot. So people have mixed reactions to that, but some people feel like it's better than my partner cheating with a human. So I do hope that AI is going to help a lot of couples in that way.
Yeah. But what do you do, Dr. Brandon?
Yes.
There are a lot of couples or individuals who are in relationships where their feeling is that if somebody is sexting an avatar, an online presence, it's not a human being, chatbot.
Yeah.
That's every bit as much cheating as doing it with a regular live human being.
Well, some people do feel, my job is to help people find a middle ground. So nobody's 100% right. Like how can we find a meeting ground on this?
Yeah.
So that's really where I come from. But other therapists would do it differently, I'm sure.
But you're the best.
Well, that's very kind of you.
But it's hard, right? So
it's hard for
I think
people.
what I think you and I have seen in our own practices is something that doesn't get discussed or acknowledged very much, which is that, number one, sex is a critical part of relationships, and that when it languishes or gets left alone to just gather dust, the sexual part of a relationship, one or both partners find outlets beyond what they have together in order to satisfy it. Like you can't, it's just wishful thinking that without some attention to this over 15 plus years, let's say, in a long-term relationship, that everything's just going to work out.
It takes a lot of effort, absolutely. And some people do just shut down sexually. Like if they don't have a active partner, they just sort of cut that part of their life out. Some people go to porn, like that's a place where people channel a lot of sexual energy.
Yeah.
And now with AI, there's going to be so many more options. But it is super challenging for people in long-term relationships. We've talked about the fact that vulnerability is a really important piece of passion, and it becomes more difficult for people to feel vulnerable with a long-term partner because, they know that partner well and they've done this whole thing before. Yeah. So it's hard to kind of find things that take them to that place of feeling exposed and open. It's a lot easier for people to feel that in an affair partner. So long-term partners have to really kind of focus on how they can create those experiences together so that they can maintain passion. It's not just like, oh, we're motivated to maintain passion, so we're going to. It's like you have to really approach it from a perspective of creating those moments that feel a certain way. Like they're not just going to happen naturally.
Right. And I would just add that if somebody is in a longer term relationship and the sex isn't happening on some relatively regular basis, there's a problem going on. And even if it doesn't bother you, you don't know what it's doing to your other half, if you will. And not bringing it up, not discussing it, not figuring out a way to address it is, in my mistaken error.
Well, I think what I love when people come into my practice and they're willing to say, I'm afraid I'm going to cheat, because now I have access to be helpful to them before it happens.
Right.
And that's where people can be motivated to fix things. Right. But people are afraid to say that to their partner. I'm afraid I'm going to cheat. I understand that.
Right. Because once the cheating happens, it's really hard to come back from that.
It's really hard to come back from that. I have a blog on, and not impossible to come back from. So let me just say that. I mean, it's true. It's not impossible to come back from, but it can be really challenging. Yeah. So I have a blog on Psychology Today. I've been writing for over 5 years. And by far, my most popular post is when you want to have sex, but just not with your partner. By far.
I love it.
Like, far and above.
That's something.
I know. So really what that speaks to is how challenged people are with this issue, and not sure how to handle it.
Right. There are a lot of people in relationships and they want to have passion for their partner. Yeah. But that's not where the passion is. It doesn't happen for whatever reason. So what are they going to do?
Right. So that's where they struggle. And so hopefully they're going to talk to their partner about it before things get worse, because they probably do get worse for most people. If they start to have that feeling, it doesn't just go away. Yeah. So
what's the name of your Psychology Today blog?
Oh, The Future of Intimacy.
The Future of Intimacy.
Yeah.
Love it.
Yeah.
Dr. Brandon, once again, it's a pleasure to be here with you.
Oh, the pleasure's all mine.
All right. Well, until next time. Then.
Okay.
Bye-bye.
Thank you for listening to The Sex Doctors with Dr. Marianne Brandon and Dr. Abraham Morgentaler. Be sure to subscribe, leave a review, and tune in next time for more expert advice on sexual health and relationships.